Good morning, members, and welcome to the Social Work Services Committee of Tuesday, the 3rd of November 2020. There's a few members here in the Council Hall, and I appreciate everybody else will be virtually connected. So welcome to you all this morning. Just to let you know, this meeting will be live streamed, recorded, and subsequently will be available to the public for listening purposes. So, firstly, if we can just get confirmation of the cedrant and apologies, and also, as Chair, I will approve members' remote participation in the meeting. Claire?
Okay, thank you, Chair. Currently in the room at English Street, we've got obviously the Vice Chair, Councillor Bell and Councillor Lever. On Teams, we have Councillors Dookie Campbell, John Campbell, Councillor Dempster, Councillor Ferguson, Justy, Howie, Ingalls, Little, Maitland, Murray and Tate. Councillor McGregor has advised that she'll be late, but attending on Teams. Not present currently is Councillor Karen Crothers, John Charteris, Councillor Sloan and Andrew Wood. Should also probably say, since the issue of the papers, we have two new members on this committee, being Councillor Charteris and Councillor Wood.
Thank you. And did you mention any apologies for the meeting today?
Thank you, Chair, for the reminder. Apologies from Councillor McClelland.
That's lovely. Thank you. And welcome to Councillors Charteris and Wood to the committee. Do we have any declarations of interest from members? Okay, I can't see any hands raised on the virtual display board, nor in the room, so we'll take that as a no. We'll move on to item 3, which is a minute of the previous meeting, 8th of September. This is for approval. Members, are we happy to approve this? Okay, thank you. In that case, we're on to item number 4, which is Social Work Services Revenue Budget Monitoring Report 2020-21 for the period up to the 30th of September 2020. I think we have Janet Sutton here to answer to that. So, Janet, can I invite you to add any comments to the report, if you wish to?
I have nothing to add to the report, Chair.
Okay, thank you. So over to members. Are there any questions on the report? I can see a hand raised for John Campbell.
Thank you, Chair. It's probably a kind of daft laddie question. In paragraph 3.1 is where it says social work staff have increasingly used different methods of contacting families, WhatsApp, video messages and Facebook Messenger. I'm just wondering, are these sort of safe and confidential ways of contacting members? I don't know who would be able to answer.
Thanks, Councillor Campbell. I'll pass it over to Lillian Kringles.
Thank you, Councillor Campbell. Yeah, what we have done through a range of different opportunities, we've got some Connect Scotland devices for our young people and families, and these are secured in terms of the software and the security around it. So we have ensured that when we are talking directly to families, then they're secured, but some of the use of WhatsApp and Facebook Messenger will be to make that contact and arrange for a then more secure conversation. So yeah, confident that the process in place has been effective in keeping in contact. Thank you.
Thanks, Lillian. Thanks, Chair.
Thank you. I can't see any other further hands raised on the laser display board. With that then, I'm happy enough to go to the recommendations, unless anybody wants to come in. And that's that we're being asked to note 2.1, that there's the anticipated financial pressures associated with COVID-19, and that's set out in the report, and that these pressures will be included within the overall financial implications of COVID-19 presented to Finance Procurement Transformation Committee on the 17th of November. So are we happy to note that? I've got a yes in the room, that's fine. And then 2.2, based on the position as at the end of September 2020 and excluding the additional costs we just mentioned, that social work services is currently projected to break even against the 2020-21 agreed budget. Happy to note? Okay, thank you. That takes us on to item 5, which is the Transformation Programme Early and Effective Intervention Family Support Work report. We have, I think it's Sarah McGarver, who's the locality manager, here to answer questions on this report. Is there anything you'd like to add to the report, Sarah, before I hand over to members?
With permission, Chair, would it be okay if I add a couple of words to this at the moment?
Yeah, sorry, absolutely, Stephen, that's fine.
Yeah. Well, I have nothing to add to the report as such, but I just wanted to say on behalf of the service and vulnerable families in Dumfries and Galloway, a thank you to members for allowing us to utilise this funding. We're confident, given the previous experience of the intensive family support service, that we can really reach a number of families who are extremely vulnerable and stop them coming into systems in time. So we're really quite excited about that. Members will also note that there is an element where we can support and develop some new third sector partnerships as well. We haven't developed those as yet. That's being quite deliberate because we have some commissions coming to an end and we want to know how we can best develop those, and also how some services might be able to, with a little bit of additional funding, develop more community-based services as well. So we're moving on to that next stage, probably post-Christmas. So happy to take any questions. Thank you for allowing me to speak.
Thank you, Stephen. Do we have any questions for Stephen? Councillor Lever.
Just in 3.5 it says that the team have been recruited and will start the week commencing the 30th of November. What do you anticipate as being the actual rollout date for the service?
Stephen, have you got a date for the rollout?
Yes, we've had a very successful recruitment campaign and we were overwhelmed with applicants. So we've recruited 14 support workers who shall start on the 30th of November. We've waited so everybody could start on the same day so that we can have an induction programme so staff are aware of what they do. And the actual hands-on work, if you like, should commence the following week.
Thank you. Any further questions for Stephen? Just for the record, Claire, there's a note from Councillor Ferguson that he'll have to leave for a meeting with the Scottish Government at 11. Now, I can't see any further hands up, but that doesn't necessarily mean nobody wants to ask a question. Councillor McKee.
It's maybe a cheeky question, but where did you find the volunteers to come in as quickly? Are they all council employees, or have you recruited people from outside?
Stephen, is that one you want to pick up?
It is, Chair, but I see that Sarah would like to come in, and as the locality manager, it might be more appropriate for her to respond.
Absolutely. Welcome, Sarah.
Yes, sorry, I missed the very beginning. We have recruited a mixture of staff. Some of them are from council employees at the moment, and some are external with a whole range of experience, some having worked in similar services elsewhere, some having worked in youth services, in residential care. So there's a breadth of experience, so I'm really enthusiastic because people are going to be able to really start going straight away, and we should be able to pick things up really quickly.
Thank you. Councillor John Campbell.
Thank you, Chair. It's not really a question, it's more an observation on page 19, where it mentions the key questions in the appendix for our children and young people. I wasn't quite sure what that question actually meant. You know, it doesn't seem to appear to come across as a question. I mean, the other bullet points do, you know, reference the way it's put down as a question. I just want a wee bit of clarity on that particular one.
Thank you. Yeah, I wondered if that was maybe a typo or a missing word or something, so I don't know, over to the report author. It's just on the first bullet point on page 19, where it says for our young people, our children and young people.
Thank you, Chair. I can respond to that. This page in the appendix was some follow-up from the event that we had last year. And I think for our children and young people, it was really about avoiding unnecessary social work intervention for our children and young people. So I apologise for the lack of clarity there, but that's what that point was around.
Is that helpful, Councillor? Thank you. And we've got Councillor Maitland next, I think.
Thank you very much indeed, Chairman. I think we're all pro this programme. There's absolutely no question about that. We all believe in early intervention. But what I would say in terms of being able to justify the spend, Chairman, the information slides off into the next report from Lillian, which is also very upbeat in terms of children and families. But if I was to go out and eyeball the public and say how this has been working and what I've actually got for their money, it's quite difficult, Chairman, through you to Stephen, to actually really capture that information and be able to say, yes, we have intervened and therefore X number of children have not come into the system. It's all there in written form. It's not tabulated. I'm sure that will come forward, but I think it would be quite useful to have in our minds what we are actually anticipating on really getting. Because for argument's sake, I know that we stipulated, when we gave the 1.8 million, we stipulated that there was to be a programme indicating where we would be disinvesting. And if you can't do that, then you've got to be upfront and say so. So I'm really saying, let's put a marker down now as a committee that we need this to be really very rigorously shown. Personally, I'm delighted. I think it's absolutely essential that we do this, but we've got to show that it's working.
Thanks, Councillor Maitland. I mean, I know in the next item the report does actually allude to the differences in terms of numbers of referrals, etc., and also the impact that the previous 18-month programme had in terms of actually sort of stopping at the source, if you like, a lot of issues that would sort of go on to be bigger problems if we hadn't sort of dealt in an early intervention model. So there's obviously a lot of learnings from that, and I'm sure Lillian can expand on that, but clearly there were also lessons where it maybe didn't quite stick with certain families, for example. But I'll hand over to Lillian, who can expand on that a bit more.
Thank you, Chair. Thank you, Councillor Maitland, and Stephen and Sarah may come in with further information around this. I think we've been crystal clear both at the transformation events and the learning from the previous 18-month pilot project around early and effective intervention. This was really about cost avoidance, so we understand the way in which young people were heading in Dumfries and Galloway, that we were having to use more agency placements. We've kept agency placements to a minimum for our young people, and we know the high cost of these agency placements if we don't intervene at an early stage and do some work alongside their families to keep those young people within their own communities. So we absolutely, as this programme unfolds over the next 3 years, will be doing regular updates to Social Work Committee. We will be looking at the evaluation critically throughout the process. But the main learning and the main issue for assurance for elected members will be the number of young people that we will prevent from having to use expensive agency placements, which is quite frankly not good for anyone. And that's always been our starting point, that this spend to save, if you allow me to use that language, will be around that longer term cost avoidance of young people having to be placed out with the region. And members will hopefully see through the last, certainly the last 4 to 5 years, we have managed to sustain our young people in those expensive agency placements to a minimum. We will always need to have young people out with region and in specialist units, but we have managed to keep that at a reasonably stable number throughout the last 3 to 4 years, and certainly our plan as we move forward will be to further reduce where we can. But certainly happy if Stephen or Sarah wish to come in to add anything to that. Thank you.
Stephen or Sarah, do you want to come in?
I'm happy to. We will be measuring everything that we're doing, the referrals we're doing, the purpose of those, where and the outcomes. We'll be getting feedback from families, which we have found really valuable to inform what we did previously with intensive family support service to what we're doing now, what works. Some of the differences that rather than have a set 12-week involvement, we'll be having, it will vary depending on the needs of the family and the assessment. We work on a signs of safety basis now, which is about relationship building and helping families develop their family network, which is going to be a lot of the role. It's going to be helping families to address the difficulties they've got and to build up supports that they have to be able to sustain the progress and to have a way of managing crisis in the future, so that should then prevent our involvement. We anticipate, with signs of safety, we've already seen a reduction in numbers of children on the Child Protection Register, but we also want to reduce the numbers of children that we have that are looked after on statutory orders. And we think that this will all give evidence of what we're doing and the success that the service is having with working with families.
Thanks, Sarah. Jane, does that help answer your concern? I mean, obviously, we're going to be hopefully agreeing that we'll get quarterly progress reports so that we can have all our eyes on this, as it were, but does that help address some of your questions?
Thank you, Chairman. I'm sure we'll take this forward and be reviewing it.
Okay, thank you. I've got just a note again for apologies. Councillor Inglis, I think, is going to have to leave the meeting, but may be able to return. Councillor Dougie Campbell.
Thank you, Chair. I'm looking at paragraph 3.8 in the report and reference to phase 1 of the Connecting Scotland programme for digital devices for young people and families. It's my understanding that in this particular phase, none of the organisations from the stewardship were successful. I note that there's going to be a phase 2 coming out in early November, and I wonder if I could offer comments on the equity of how these devices will be distributed. It may well be that although no organisations within the stewardship were successful, and that in fact families did benefit from this, and if that's the case, I apologise, but it'd just be interesting to know what the proposed distribution of these devices will be across the region. Thanks, Chair.
Thanks, Councillor Dougie Campbell. I'll pass over to Lillian to address that.
Thank you, Councillor Campbell. I can assure you that individual families in the stewardship did receive some of these devices, and if it would be helpful for all members, I could provide a breakdown for not obviously on the individual families but per locality in terms of the distribution. What I would say is that obviously we put a bid in for individuals and families, so the award that we got was to facilitate that need that we had for our individual children and families, but the application for third sector partners and organisations was done through Richard Grieveson's team. And again, if it would be helpful, Councillor Campbell, I could get an update on how that distribution took place. We certainly have made a further bid in phase 2, and again this is for our individual families and for us to undertake that individual work in terms of connectivity for our young people and through our youth work services. So I can get more information, but I can absolutely assure you that families in the stewardship did receive devices. Thank you.
Does that answer your question, Councillor Dougie Campbell?
Yeah, if I could just briefly come back, Chair. Lillian, thank you very much. That's very helpful to know that. I'm just wondering if feedback to unsuccessful applicants can be looked at as well, because there was a lot of sort of grumblings about not being successful, and the two organisations that I'm thinking of have got a lot of experience in working with young people and families, so perhaps the feedback to applicants could be looked at as well. Thanks very much.
I'll certainly raise that with Richard and his team and ask for that to happen. Thank you, Councillor Campbell.
Thank you. So I can't see any other hands up. Sorry, Councillor David McKee.
I appreciate what you're saying about you can give them equipment, but what about broadband access? Is that always available? Given the rural locations, that can be a difficulty as well.
Certainly, as part of the equipment that came from Connect Scotland, there was also the I won't know the right terminology, but I think it's a dongle. Is that correct? Yeah, that came with the device. So it wasn't just the device that came. It also came with the connectivity for a year. So there is access to the internet for our young people through that process, that technical solution. So it wasn't just the device. Forgive me if I haven't got that terminology correct. Thank you.
No, it might be of interest, but there's a device called, as Lillian points out, it's called a MiFi, which is basically a portable Wi-Fi. And I think the Connecting Scotland programme means you get a MiFi device that gives you 8 gigabytes of data a month for free for a year. I think that's roughly the kind of thing. So it allows everybody to sort of get access without having to buy a contract for broadband, if you like. So with that, I can't see any other hands up. Sorry, I can see Councillor Maitland does have a comment there about a link to the digital coverage, and the household survey indicated limited access. Sorry, I shouldn't actually read out what's in front of me because it's actually not helping anybody. Councillor Maitland, did you want to actually come in with a question on that, or I can just pass on?
No, thanks very much. It was just that the question was being answered. I asked the same question as Councillor McKee, and it was being answered. Thank you.
Thank you. We'll get the hang of this technology, I think, one day. So in that case, I can't see any other questions or hands up, so we'll just go to the recommendations, and that's 2.1, to note the full council agreement for the investment of the 1.815 million to progress the Transformation Change Programme. 2.2 is to note the progress on the development of the work to date, as revealed in paragraph 3.5, and 2.3 is then to agree that we get the quarterly progress reports to this committee so we can review and scrutinise progress and impact. Are members happy to agree the recommendations? Thank you very much. So on to item 6, and this is the Chief Social Work Officer's annual report for 2019-20. This is something the Chief Social Work Officer is required to prepare, and this is our opportunity to ask the questions of it that we see fit. Obviously, there's an additional aspect to the report which deals with COVID-19, which is very unusual and one-off, hopefully, pandemic that's affecting us. But I'll pass over to Lillian if she wants to add anything, and then open it up to questions.
Thank you, Chair. Thank you, members. As Chair has indicated, this is my annual report, which takes us up to the period of the 31st of March 2020. It is in a reduced format this year, just given the challenge of us dealing with the COVID-19 pandemic. But I hope I have managed within that report to capture the information which will show members some of the ongoing activity within social work services. There is obviously the element at the back of the report which also covers the response to COVID since the outbreak, which was round about the beginning of March for social work services. But I would like to take this opportunity to thank members for their support both throughout the period of 2019 to 20 that's covered within the annual report, and also during this pandemic period. I would also like to acknowledge, and I hope I have acknowledged it within the report, the absolute commitment of social work staff both throughout that preceding period of the pandemic, but also during the response to the pandemic, which quite frankly has been phenomenal from social work staff. I think as we have continued through the process since the beginning of March till we currently are now phasing phase 2, then social work has continued to respond as the absolute frontline service, along with other colleagues and other partnerships. And I think it's important for me to note the impact on our staff, but the response has been phenomenal from them. I certainly wish to have it acknowledged how proud I am of the staff, and I'm sure members would join me in that as we move forward in this discussion. In terms of the actual report, I would just like to draw members' attention to the increased demand for social work services. There are statistics on page 33, 37, 42 and 43, which really shows you the increased demand for our services and some of the growth areas that we have tried to work through and continued to manage and contribute to making Dumfries and Galloway a much safer place to live, particularly around our justice services and our protection elements. I'm certainly not planning to go through the whole report, but there are some bits that I think are worth mentioning. I've already brought back the outcome of the criminal justice inspection, and again, I'm very pleased with that outcome. Whilst we can always do better, and we would never rest on our laurels in social work services, I was delighted to see the outcome of that report. And also just to acknowledge the amount of work that's been done within the partnership and the wider social work services. Thank you, Chair.
Thank you, Lillian. And I think as Councillor Ferguson leaves to his other meeting, he did record his commendation of the report. And I think it's only right that we should acknowledge and commend yourself and the staff working under significant and sustained pressure during these times. So I think we should record that. In terms of questions, we first all have Councillor Graham Bell.
Thanks, Chair. Certainly a welcome report as well, Lillian, and most of the members do as well. Page 57, we're talking about the Adult Resource Centres, ARCs. I know they were closed down in March, and the timescales, they're starting to open up again. I know you've obviously been very difficult. Our families are under stress. Disabled children, disabled people are under stress. You've tried ways of interacting through social media and various things and that. What services are available for the families that have been put under this sort of serious pressure and stress? Because I know for some I'm not going to talk about for one specific example, but I know we need to be some sort of counselling to deal with some of the parents or the service users as well, because it's been a long period of time, and it's been a difficult time, not just for yourself in social work. Everybody else has been struggling. It's not just the people from the ERCs, it's across the region in the United Kingdom. So what we're doing to help some of the parents get over these issues?
Thanks, Councillor Bell, and absolutely agree with your point raised. It's been an extremely difficult time for all of our families. I have Rebecca Aldridge on the call, and Rebecca may wish to come in and add some further comment on this. We have tried to offer different services throughout the region for families and for service users. We are working very hard to have those that we would view to be the absolute priority back into some level of service within our day centres and activity and resource centres. And we have been working very closely with our carer centre to make sure that we are assessing the need of the families. It would be remiss of me not to acknowledge the absolute commitment that families have made to their young people, to their older caring challenges and responsibilities. But unfortunately, because this group in particular is our absolute most vulnerable, this virus, it doesn't choose. Would be the best way to put it, and we are so concerned about the vulnerability of those service users being back in what would have been my description, a quantity resource rather than an individual bespoke resource. So we have to look at how do we work with our families to make sure that we prioritise those that will go back into that service on probably a reduced basis. but trying to maximise everything that we do have, and we're trying to open up the time that the service will be open from 8 in the morning to 8 at night to try and make it accessible for more families. But we can't underestimate the impact it's had over this previous 7 months. We will be working with our colleagues in the Carer Centre to do individual assessments of carers, and then we will have to collectively as a partnership look at what supports are available. And I would just ask if Rebecca's got anything to ask Councillor Bell. Thank you.
Thanks, Lillian.
Thanks,
Rebecca?
Thank you. I think, Lillian, you've articulated that extremely well on our behalf. I think the only thing that I would add to that is that we are committed to communicating with families, and as part of the process, since ARCs have closed and in other areas, we do make contact with families and carers on a regular basis to just to check in to see how they are, and that's allowed us to work with families to support those most in need at the moment, because the other part of the challenge that we have is many families are extremely anxious and do not want services in place at this time. So we have a mountain to climb in that respect, trying to support them to feel less anxious, to understand the risk assessments and all of the work that we're undertaking on their behalf to try and get services and their loved ones back into services. Thank you.
Councillor Bell, do you want to come back? Thank you. Now, Councillor Murray.
Thanks very much, Chair. First of all, just to say, it's to echo, I think, from the comments of others, that it is an extremely interesting report, and to thank Lillian for it. It certainly provides a great deal of information for us. And I'd also like to put on record our thanks to all the social work staff and the way they've had to work during the COVID period. It's been incredibly stressful for people, and they've really gone well above and beyond. And I think, as councillors, as elected members, our thanks for that should be recorded. I wanted to ask a question about the Grow Your Own schemes. I was pleased to see that they're successful and that there are 6 staff in the studentship programme at any one time. But also, I see that there's more applicants each year than that we have vacancies for. And given the pressures that are on social work, should we be considering in expanding the scheme? Obviously, there'll be financial and budgetary consequences of that. Or would it be the case that if we had more people on the scheme, there wouldn't be jobs for them at the end of the day? So is that something we should be looking at?
Thanks, Councillor Murray, and it's certainly something that I picked out in the report as a positive, but I'll certainly hand over to Lillian to give her view.
Thank you, Councillor Murray. I absolutely agree that it's something that we need to keep looking to see if we can resource, because there is a national shortage of social workers, and we've historically had an issue because we are very much a rural, large regional organisation, so we've always had an issue with recruitment. And, for me, the Grow Your Own scheme has been invaluable in making sure that we have the social workers, the professional social workers available to meet the demand of the statutory service delivery. What I think this reflects as well is that we have done a lot of work on supporting what I would use the terminology of our paraprofessionals, and we have got some really highly skilled paraprofessionals that could easily step into the role of social work as a profession, having undertaken the university training. So it was certainly an area in terms of succession planning that we would like to look to develop, and an area that we have as a service look to invest in, but certainly it would be something that as we move forward, and unfortunately none of us know where we will be with the outcome of this pandemic around the budgetary constraints, but it would be an area of growth that would be welcomed by social work if at all possible, and I'm certainly happy to do some further work around that. What I would say to you is that we always have vacancies for professionally qualified social workers. We never can fully fulfil those posts because, as I say, there's a national shortage, and we suffer from being on the border where folks can go and practice in Cumbria who have a different pay structure from us, and also the Central Belt tend to also be able to attract social workers to go there before they think about coming to Dumfries and Galloway. However, we have done a lot of work around that, and we have been more successful recently in some of our links with the University of the West of Scotland to try and offer more placements within the region, and then folks want to come and work with us once they're qualified. So it is more than just the Grow Your Own, but the Grow Your Own's absolutely been a very successful scheme for us that I would be very keen to continue to develop. Hopefully that provides the overview. Thank you.
Councillor Murray, do you want to come back?
No, just thanks for that. I think it's something we need to bear in mind. Yep. Thank you.
Thank you. Councillor Dougie Campbell.
Thank you, Chair. I'd like to ask a question about domestic abuse. Now, Chair, please stop me in my tracks, but if you want to, but I would like to push my luck and ask a question that goes beyond the scope of Lillian's annual report. You know, there was a lot of sort of discussion an early stage in lockdown about an increase or a potential increase of domestic abuse. And I'm reflecting that we now have a new 5-tier system in place in Scotland. And Dumfries and Galloway could be placed under further restrictions to what we have just now, but also we have the possible prospect of a further lockdown. I was just wondering if Lillian could maybe reflect on the impact of lockdown on domestic abuse and what implications there are should we go up a tier or go into lockdown. Thanks, Chair.
Thank you. So it's almost about if there's a correlation between the change in levels and the number of referrals. Lillian, is that something you're able to pick up?
Thanks, Councillor Campbell. I'll try and obviously answer as clearly as I can. I would anticipate that next year's Chief Social Work Officer will show you a huge increase in our activity around public protection. There's certainly been an increase in domestic abuse, and we have been working with families that in the past we would never have worked with before. And that's, I would anticipate, is around the breakdown in family relationships and folks living closely together and not having the supports of family or friends around. For example, we had a situation where the information passed to the social worker was that the woman in question knew when things were becoming difficult and normally would have left the family home but had nowhere to go, so consequently unfortunately there was quite a violent attack on that woman. So there is no question there's been an increase. This has been raised through the Public Protection Committee, and certainly the independent chair along with the 3 vice chairs are reporting regularly back to the Chief Officers Group about the increased demand around public protection. Certainly Gordon may be on the call, Gordon Pattinson, who is our Public Protection Manager, although he is going off to cover an emergency strategic MAPA group for me, given some of the increase around managing very high-risk offenders at the moment. So the short answer is we are aware of a huge increase in the public protection agenda. Our child protection numbers have and are continuing to grow throughout the pandemic, as our adult support and protection numbers. We're working hard to deal with this increase in referrals. It's not reflected in this report because it was up to the 31st of March, but I can confirm without going into any significant detail that there will be a significant reporting of the rise of domestic abuse throughout the region. Thank you.
Councillor Dougie Campbell, is that, would you like to come back on that?
No, I don't think so. Thanks, Chair. Thanks, Lillian.
Thank you. Councillor Jane Maitland.
Thank you very much indeed, Chairman. Lillian, there was a data sharing project between the partners, Health and Social Care Partnership. How complete do you think that has become? Do you think that work is completed?
Thanks, Councillor Maitland. I wouldn't say to you it's 100%, but it's certainly well in the region of 80% now. So there has been some issue around gathering some of the data that links to the third sector and independent providers around care at home. But that work is certainly well progressed now, and we're in a much stronger position. And actually, I always like to look at the silver linings of any situation, and we've certainly been more robust in sharing appropriate data throughout the pandemic. So I would be confident through the Health and Social Care Executive Group that we're well on the way to having that reaching the 100%. Again, I wouldn't like to go into some technical conversation because that's way out with my comfort zone, but there has been some technical issues which has taken it a bit longer than was anticipated. But I would say to you, we're well in the region of 80+% in getting that issue resolved. Thank you.
Councillor Maitland, does that provide you with sufficient assurance?
It's very helpful. Thank you very much indeed. I wonder whether when we might anticipate getting to 100%.
I couldn't give you an exact figure, Councillor Maitland, but I'm happy to take that back to the Health and Social Care Executive Group and ask for an update. If that would be helpful, I could share it with the committee. Thank you.
I think that would be very welcome. Councillor John Campbell.
Thanks, Chair. Thanks for your report, Lillian. I'm looking at page 40, statutory mental health and in particular the emergency detention orders. I see that 32 of these were without consent of a mental health officer, which is almost double of the previous years. I'm just wondering, do we endeavour to try and, if we're doing an emergency detention order, that we do get the consent of the health order? And just on a second point, on page 41, it mentions that the mental health officers completed reports to attend 32 tribunals. I'm just wondering, is there a relation between the two 32s? Are they one and the same, or is that just coincidence that we've got 32 tribunal appeals and 32 without consent? Thank you, Chair.
Thanks, Councillor Campbell. Yeah, those will be the same 32, and we certainly had a bit of a challenge in terms of the NHS mental health services alerting us that there was some incidents going on out of hours, so we've put some new procedures and processes in place to make sure that that doesn't happen as we move forward. So what would have happened in those 32, they would have been detained without consent and without the mental health officers being involved, and then there would have been certainly within the 24-hour, 48-hour timescale, we would have had to be part of that process. But I wouldn't say to you that we are absolutely confident that we would always be alerted now, but certainly we've got a much more robust process in with our out-of-hour service. And as we do move forward and having that front door service much more aligned with colleagues in NHS and our out-of-hour service, it's certainly we're working towards the single point of access. I would be more confident that these will be fewer, but I would say to you that we've done a lot of work around that, and we're certainly addressing that, because quite rightly, you've alerted that would be inappropriate for me, and it's certainly an issue that we've raised, and we're working towards a resolution. Thank you.
Thank you. Is that okay, Councillor Campbell?
Yes, thanks, Lillian. Thanks, Chair.
Councillor Lever.
Thanks, Chair. Yeah, it is a very good report, and it does show a massive amount of work which social work services does. A lot of it in the background to most of us. But my question's related to the supported lodging providers on page 35. I see we've got 13 support lodging providers across the region. Does that meet the demand for them, or do we need to recruit more? And if so, how do we recruit them?
Yeah, thanks, Councillor Lever. We generally have enough capacity. However, members are aware, I've raised this a number of times at committee, that we do have a number of unannounced asylum-seeking children that will arrive either through the port at Stranraer or on the M74 at Johnson Bridge Services. So we have recently had some challenges around the appropriate supported lodgings to meet those young people's needs, because they're coming into the country and you know, there's a whole range of language issues, etc. So we have been doing some work with some of our local providers, and we're developing further supported accommodation. We don't need a huge amount of additional capacity, but we certainly are on the maximum, and we use this supported lodgings to the maximum capacity, particularly for our leaving care young people. So children and families, and I'm not sure if Stephen's still on the call, but certainly Stephen and his team are looking at that increased capacity. But we do have a lot of real positive supported lodging providers, and they are working with us to try and increase that capacity. Thank you.
Okay, thank you. Councillor Giusti.
Thank you, Chair. One of the questions that a member of my group raised that they couldn't be here today. Page 58 is discussing the amount of unpaid community payback orders and the hours that we've got outstanding. It's down to 33,000 from the last social work committee, which I believe the outstanding hours was at 39,000. Is that, how did we drop 6,000 hours so quickly?
Over to you, Lillian.
Thanks, Councillor Giusti. We're actually down to 29,000 now. So what we've done, we've been looking much more and engaging with our communities to do what we would call individual placements. So we've obviously got reduced capacity in our squad work, because the minibuses now are only allowed to take 2 service users, and in terms of social distancing, when we're actually out there doing those community requests, then we're reduced in terms of that activity. We normally have 5 unpaid work hours to be facilitated in any one squad, so we're down to 2 in each squad. So what we have been doing with our partners is working towards increasing the individual placements, and the team have been working really hard to do unpaid work in all different aspects, and looking at quite forward-thinking ways in which to reduce those hours. And I know that Catherine Knight, who is the manager for unpaid work, is on the call, and I don't know if Catherine would wish to add and give you some more overview just on some of the different ways in which we're working, if that would be acceptable, Chair. Thank you.
Thanks, Lillian. Catherine, are you able to join?
Yes, I'm here. Thank you, Chair. Just to emphasise the comments that Lillian has made, because of the restrictions of the numbers that we can have in groups on what would be considered the more traditional unpaid work group activities, we have spent a lot of time extending the range of options available. Both in terms of doing the practical type tasks that we've always done, but we've also increased the more educational side of things, and we've done a real push on online learning. So we continue to increase the range of options available for our unpaid work service users.
Thank you, Catherine. Councillor Giusti, does that help answer your question?
That does, Chair. Thank you.
Thank you. Well, we've had a good round of questions and considerations about the report there, and I think what's come out is a fairly unanimous commendation from the members of the committee to record our commendation of the report, and obviously to acknowledge the staff commitment and the excellent quality of their work, and also to thank Lillian, of course, for her work and also her leadership in providing the report as well. So I think if we're happy to agree that committee, then I think that would do justice to the work that Lillian and her team have put in. Okay, thank you very much. The next item is item number 7, which is the minute of the meeting from the Public Protection Committee of the 23rd of June 2020. Are we happy to note that? Thank you. Well done, everybody. That's us for the day. I've got no further business, and thank you all for your contributions. Thank you.